Assalamu alaikum, Dr. Nazim here with another video. This video is about Acanthosis nigricans. So as in the picture you can see, there is black discoloration of the skin of the neck in the previous picture, and this is the skin of the underarms that is showing almost thickening a bit. Black pigmentation of the skin seems to be a bit dry and rough. So this condition is referred to as Acanthosis nigricans, in which basically there is a thickening and thickened, roughened, and a bit velvety appearance of the skin because of the hyperplasia of the spinous layer of the epidermis. This condition is usually associated with obesity and is taken as a sign of insulin resistance. So in people who have adequate insulin but the insulin function is not being properly performed, or the biochemical changes within the body, they are not allowing the skin to work properly, right? So this results in the increased pigmentation of the skin of the underarms, of the that of the neck, of the back of the neck, and that of the skin of the intertriginous areas. So all of these areas, the skin in these areas gets a bit thickened, pigmented, and has a velvety appearance. So in any patient, if you come across this sign, so this is basically a mark of insulin resistance in most of the cases, especially in those who are already obese. However, you can look for other possibilities, like can be familial or genetic. Other possibilities are that it can be because of some syndrome, like some syndromic features. If some syndromic features are present in the patient, then you can look for that particular syndrome. Common syndromes that are associated with such pigmentations are Bloom syndrome and Clusen syndrome. In that case, you will be having some typical features related to that syndrome. Another possibility in which the skin becomes dark and pigmented, especially in children, can be in congenital adrenal hyperplasia or Addison's disease. But in that case, especially in the case of congenital adrenal hyperplasia, you may look for any genital abnormalities in that child. Look for hypertension, any history of recurrent episodes of dehydration or failure to thrive, or history of genetic virilization or adult body odor from a child. So all of these things are associated with the congenital adrenal hyperplasia that you're going to confirm from certain labs, from the blood biochemistry, from certain hormonal profiles and imaging testing. Another possibility is Addison's disease. In that case, pigmentation is usually limited to the skin creases and the mucous membranes. Genitals may also get pigmented. Plus, there will be features of recurrent episodes of unconsciousness due to hypotension, syncope, or hypoglycemia. And there will be certain electrolyte abnormalities in the form of salt wasting, like there will be hyponatremia and hyperkalemia and metabolic acidosis. All of these features will be associated with that. uh, when there is no such clue towards such diagnosis, and the patient is obese and especially a female with hirsutism and some disturbance of cycles, so in that case you are going to suspect for the type 2 diabetes mellitus or metabolic syndrome. In such cases, there will be glucose intolerance, there will be hormonal disturbances and disturbed cycles. In married females, there will be hypofertility or infertility. So, uh, in any case, your diagnosis depends upon the combination of the history, uh, clinical features, and the lab findings that you are going to get from different labs. What is the treatment? The treatment, if it is the metabolic syndrome or it is associated with the type 2 diabetes mellitus, so in that case, the topmost thing is counseling, that it is a multidisciplinary approach. You may be requiring a medical specialist, you may be requiring or a pediatrician, a nutritionist, physiotherapist, uh, to guide you about certain exercises which will help you in weight loss. Secondly, lifestyle changes, in which you have to do some aerobic exercise at least 30 minutes a day for at least 5 times a week. So this is ideal. If you do this, it has the best outcome. It is going to control your insulin resistance, going to control your glucose intolerance, and if you are having hypertension along with that, so it is also get controlled with that. Second comes the diet. So the common dietary changes that are advised so such patients is to decrease the intake of refined carbohydrates, refined sugars, decrease the intake of saturated fats, and increase the intake of complex carbohydrates, like increase the intake of vegetables, uh, and whole wheat cereals. Other things, you can take barley. It is very good, having a low glycemic index, controls the blood glucose and also lowers the cholesterol levels as well. Increase the intake of mono and polyunsaturated fatty acids, that is very much important, such as olive oil, fish oils. They basically control your cholesterol levels, increase the levels of HDL, and lower the levels of VLDL and LDL. So they balance and the overall cholesterol profile of your body, decreasing the incidence of heart diseases and things like hypertension. Fourth thing is increase the intake of proteins, and proteins should be from the white meat because it is having lower fat and more protein, so it is having a better overall health. So next comes the medications. So medications that are usually given, they are to reduce the weight and control the blood glucose levels, because ultimately the type 2 diabetes gets converted into type 1 diabetes, because insulin resistance is basically a relative insulin deficiency in which the insulin is not up to your body requirements. So if you are not going to control the blood glucose and the insulin resistance, so what is going to happen is that you will ultimately develop the type 1 diabetes. For that, oral hypoglycemics are given, and certain newer drugs are also there which reduce the incidence of type 1 diabetes mellitus many times. So one is that for your glucose intolerance. Next, if you are having any deranged lipid profile, so it depends upon the severity of the derangement. According to that, you are going to be given the lipid lowering drugs. In children, the only FDA approved drug for the obesity is Orlistat, which causes the weight loss and is having fewer side effects, so it is FDA approved. But in any case, you are going to be directly dealt by an expert medical practitioner who is, or pediatrician, who is basically dealing your child case or your case. So this was some of the information, not all of it. It's a whole chapter, and the discussion may go on for a long time. So this was some important information about Acanthosis nigricans and its possible association. The major association is with insulin resistance and obesity and type 2 diabetes mellitus. So next time we are going to bring another informative video about the common health problems.